Did you know heart disease is the #1 killer of women worldwide, yet millions don't realize they're at risk? In fact, heart disease is the leading cause of death for women in the United States, accounting for 1 in every 5 female deaths, and over 60 million women in the US are living with some form of heart disease. What's even scarier is that women's heart attack symptoms often look nothing like men's, and this simple difference can be deadly. This disparity stems from several misconceptions, including the belief that heart disease is primarily a man's disease, which often leads to it being understudied, underrecognized, underdiagnosed, and undertreated in women. Today, we're diving deep into why women's heart disease symptoms are so often overlooked by women themselves, by doctors, and even by medical research. We'll explore the historical biases and societal factors that contribute to this critical oversight, impacting countless lives. By the end of this video, you'll know exactly what signs to look for and how to protect yourself or the women you love. This knowledge is crucial for early detection and effective treatment, empowering you to take control of your heart health. Every year, heart disease tragically claims more women's lives than breast cancer, ovarian cancer, and lung cancer combined. This alarming statistic underscores the urgent need for greater awareness and understanding of heart disease in women. Despite this alarming reality, surveys reveal that less than half of women are aware that heart disease is their leading health threat. This lack of awareness is a significant barrier to early intervention and prevention, putting many women at unnecessary risk. Many still mistakenly believe heart disease is primarily a man's disease, a misconception that can have dire consequences. This outdated belief often leads to women dismissing their own symptoms or healthcare providers overlooking them, delaying critical care. The most common heart attack symptom for both men and women is chest pain or discomfort, but women often experience less obvious signs. It's vital to understand these distinctions because recognizing them can be the difference between life and death. Men typically report crushing chest pain, left arm pain, or a pressure like an elephant sitting on the chest. These classic symptoms are widely recognized and often prompt immediate medical attention, forming the basis of many diagnostic guidelines. However, women are more likely to experience shortness of breath, nausea, vomiting, or indigestion. These symptoms can be easily mistaken for other less serious conditions, leading to delays in seeking emergency care. Other common symptoms for women include back, jaw, or neck pain, extreme fatigue, and lightheadedness or dizziness. These subtle yet critical indicators are often overlooked, both by women themselves and by medical professionals. These are often called atypical symptoms, but for women, they are very common, a fact often overlooked due to historical research biases. The term atypical itself highlights how male-centric medical research has shaped our understanding of heart disease. For decades, clinical trials primarily focused on men, creating diagnostic guidelines based on male biology and leaving women underrepresented. This significant research bias has had profound and lasting impacts on women's healthcare, leading to diagnostic gaps and misinterpretations of symptoms. This bias leads to diagnostic gaps where emergency rooms, trained to look for classic male signs, often misinterpret women's symptoms. When women present with symptoms that don't fit the classic male presentation, their conditions can be overlooked or misdiagnosed, delaying crucial treatment. When women present with nausea, fatigue, or back pain, they are frequently told it's stress, anxiety, or acid reflux. This dismissal of symptoms can be incredibly frustrating and dangerous, as it prevents women from receiving the timely and appropriate care they need for a potentially life-threatening condition. Studies show women wait longer than men to seek medical attention because they don't recognize their symptoms as heart-related. This delay is often compounded by the fact that their symptoms are frequently dismissed by healthcare providers, creating a cycle of delayed diagnosis and treatment. To protect yourself, know the common risk factors: high blood pressure, high cholesterol, smoking, diabetes, and obesity. Understanding these factors is the first step in proactive heart health management and prevention. Also be aware of unique risks for women, such as pregnancy complications like preeclampsia, gestational diabetes, early menopause, and autoimmune diseases. These specific risk factors highlight the need for a gender-specific approach to heart health. Listen to your body. Do not ignore unusual fatigue, nausea, or pain, even if they seem minor. Your body often provides subtle warnings, and recognizing these early signs can be critical for timely intervention and better health outcomes. Advocate for yourself at the doctor's office. Ask directly, could this be heart-related? Being assertive and informed about your symptoms and risk factors can ensure you receive a thorough evaluation and appropriate care. Women's heart symptoms aren't weaker, they're just different. And because medicine has traditionally been designed around men's bodies, countless women's lives have been put at risk. It's time to challenge these historical biases and ensure equitable healthcare for all. If you're a woman or you love one, take this knowledge seriously. Recognize the signs, speak up, and don't let your symptoms be dismissed. Empower yourself and others with this vital information to protect against heart disease. If this video helped you, please share it with another woman in your life. It could truly save her life, fostering a community of informed and empowered individuals dedicated to heart health awareness.